Hello and welcome back to E&M Essentials. My name is Madison Carter and I'm a certified medical coding instructor. Today I'm going to be covering common modifiers that we use with E&M services. If you're a complete beginner to E&M and you missed my previous E&M Essentials video, check out my channel for the E&M Essentials playlist. Let's jump right in. So for today's objectives, we're going to be looking at E&M specific modifiers 24 and 25. I'm also going to compare and contrast modifier 25 with modifier 59 because I noticed that a lot of students confuse these two modifiers and they ask me a lot of my students ask me when to use 25 and when to use 59 when it comes to E&M services. So we're going to take a look at those. Modifier 25 is used when you need to report a separately identifiable E&M service on the same date as other services, whether it's another E&M service or it's a medical or a surgical procedure. The E&M service must be performed by the same provider that's also performing the other service. The two distinct services don't necessarily require different diagnosis codes, but they generally have to be performed for different reasons. Let's look at an example here on this slide. A patient is being seen for an annual physical. During this visit, the patient mentions flu-like symptoms. The provider completes the physical, then she performs a separate history and exam for the symptoms. The patient is ultimately diagnosed with the flu. This encounter is going to be reported with 99393 and 99213 with modifier 25 appended to it. 99393 is reported for the annual physical or the annual wellness exam, but after completing that entire service, the provider is not going to just dump this patient out the door and tell them that they have to schedule another day for their sick visit. The provider is going to complete basically an entire additional visit, including a complete history with physical exam, and she likely even ordered a flu test during this visit, although we don't necessarily see it here in this collapsed documentation. This is significant additional work that's not performed during an annual wellness exam. So in this case, you can report the additional sick visit with an office visit E&M code as a secondary procedure. Now, in order to report that secondary procedure, you're going to need to add modifier 25 to the second visit, that 99213. Let's take a look at another example. A patient is seen in the office for a severe illness, and the provider decides to admit the patient to hospital observation care that same afternoon. In the hospital, the same provider performs a complete history and exam with multiple tests ordered. These two encounters can be reported with 99222 and 99214 with modifier 25 appended. Now, in this case, the provider completed work during the office visit, but she also completed additional significant work in the hospital. In this case, we can report the hospital service first because it's a higher complexity service, and we can also report that office visit as a secondary service. It's a little bit lower complexity. We still have a high level E&M, that 99214, but technically an office visit is going to be a little bit lower complexity than a hospital service. So we're going to report that secondary E&M with modifier 25. Now, in this case, you probably are going to have the same diagnosis code with both of these, but that modifier 25 is saying that the office visit was separate. There was separate work done for that office visit from the separate work done at the hospital. Now, a really important thing to note is that you would not report modifier 25 if you're reporting an initial hospital care service and subsequent care or discharge services. So if this patient was just in the hospital, let's say, you're not going to report that you're not going to report that initial visit, the 99222, and a subsequent visit with modifier 25 appended to it, because those are telling you that they are distinct from one another. So you don't need a modifier to distinguish an initial hospital visit from a subsequent hospital visit or from a discharge service at the hospital. Okay, so now let's compare and contrast modifier 25 and modifier 59. A lot of new coders, a lot of my students tend to confuse modifiers 25 and 59 because on the surface they seem really similar. But if you read the descriptions very carefully, you're going to see that they can only be applied to different codes or to different services. Modifier 25 can only be applied to E&M codes. On the other hand, modifier 59 can be used on any non-E&M CPT code and any non-drug HCPCS code. Additionally, to use modifier 59, that code, either the CPT or the HCPCS code, has to have a National Correct Coding Initiative procedure-to-procedure indicator of 1, and it's not going to be, again, it's not an E&M or a prescription drug code. Now, modifier 25 should be used if it was medically necessary for the two E&M visits to have occurred on the same day, or if an E&M service was performed in addition to a procedure. Modifier 59 should be used when a surgical procedure is not normally performed with another procedure or service, including an E&M service at the same encounter. So modifier 59 is going to be applied not to the E&M service in that case, but to the surgical procedure. Now, in either of these cases, you should not ever apply a modifier just to get paid, or because the biller or because the payer told you just go ahead and add it and the claim will be paid for. If the reimbursement has been denied for bundling, you want to carefully review your modifier guidelines. You want to go to your National Correct Coding Initiative procedure-to-procedure edits. You want to go to your payer-specific guidelines. You want to review to determine if it would be appropriate to add modifier 25 to your E&M service, modifier 59 to your non-E&M, non-drug procedure code, or another modifier or no modifier at all. Modifier 24 is used to denote an E&M service that was provided during a postoperative period. And that postoperative period or the E&M service has to be unrelated to the procedure during that postoperative period, and it has to be performed by the same provider who performed the surgical procedure. Sometimes students confuse 24 and 25, but they're very distinct because of that post-operative period phrase at the end of 24's description. Let's take a look at this example here. A patient who recently had a hip replacement procedure returns to the orthopedic surgeon for a routine post-op visit. Now, during the visit, the patient complains of new shoulder pain. The surgeon completes a new exam of the shoulder. This encounter can be reported with 99213 with modifier 24 appended. Now, maybe you're scratching your head why we would only report one E&M code when in our previous two examples, we reported two codes for the two separate E&M services. Here, because the post-op follow-up visit is not reported for separate payment because it's included in that surgical global period, we only report the payable E&M service, which is the unrelated exam for the patient's new shoulder pain. In order to unbundle this procedure from the global period, we apply modifier 24 to show that this 99213 is unrelated to the hip replacement procedure. It's for new onset shoulder pain. Now, of course, your diagnosis code is also going to show that, but in the world of coding, we have to apply a modifier in order to unbundle it. Just having a separate diagnosis code is typically not enough to unbundle an unrelated service. So here's some study tips for you. Memorize modifier 25. It's the most commonly used E&M modifier. You're going to see it a lot both in your practice and you're going to see it a lot in real-world production coding. Also, check out the American Medical Association's guide to using Modifier 25. I've put a link in the description below. You can get a free PDF copy of this guide, and it's very helpful with some additional information and a lot of what I talked about today. If you do still find that you're struggling with E&M modifiers or you're just struggling with E&M in general, continue to check out my E&M Essentials series as I continue to post new videos, or consider checking out my weekly study group sessions. I hold weekly study groups every Monday, Thursday, and Saturdays, and I'd love to have you join me. We get together, we have a lot of fun, do some practice together, and I answer as many questions as I can within the hour. Anyway, I hope you found this video helpful. Good luck and happy coding!